Welcome back everybody, my name is Dr. Dev and this is my sleep assistant Barney. Hey Barney, how's it going? Oh, hey, handshake, nice one. Today we're going to talk about post-traumatic stress disorder and sleep. We'll have a number of videos where we focus on mental health and sleep. Mental health doesn't go away when the sun goes down. It's still there at night time and it morphs into sleep disturbance. And if the sleep is disturbed, the mental health is disturbed. Post-traumatic stress disorder, or PTSD, is very common in Australia. In fact, 1 in 8 people suffer from PTSD. And it is due to a number of triggers, such as accidents, which is the most common in Australia, but also other life events causing trauma, particularly child abuse, work-related trauma, natural disasters, for those who are fleeing war, including veterans as well who've been in war, torture and assaults. PTSD is a particular sort of reaction such as fear and helplessness and horror that unfortunately they relive again and again and again, even when they've escaped that trauma. And they have that panic and extreme fear, similar to almost what they felt like when they were in those traumatic times. And there are a number of difficulties that patients with PTSD experience. One of them is reliving that traumatic event. So they relive the event through unwanted and recurrent memories, such as vivid imagery and nightmares at night time in their sleep. And this will invoke quite emotional and physical reactions, sweating, heart palpitations, hyperventilation, just sheer panic. Then there's the hyperarousal state, or just being alert and wound up. And this also impacts on sleep and causes immense insomnia, difficulty in initiating sleep, maintaining sleep due to that hyperarousal and that busy brain and that fear and alertness and ready, steady, go. It's a huge problem in those with PTSD. Easily startled as well at night time. Any little noise, or if their partner's rolling over, that movement might just suddenly wake them up. Many of those with PTSD are constantly avoiding reminders of the past, avoiding activities or places or certain people that might associate them with the event. And that also exacerbates their feeling of intense fear. And only last week, for example, I had a patient with PTSD from work bullying. He was a shop fitter for a fast food chain. And if he's going into town, he would explicitly work out where those stores are. So he'd avoid those paths and those roads, just in case there's a fear of stumbling across that fast food chain shop and then having that intense fear of the PTSD. And many patients with PTSD just feel emotionally completely numb. They just lack interest in day-to-day work and pleasure, and they detach themselves from the family and just hide away for days and days. With regard to sleep, there is that hyperarousal state with that difficult initiating and maintaining sleep, and then the nightmares. And the problem is they have those recurrent recalls of those unpleasant traumatic events. Almost it's rehearsed that every night it's the same imagery. And it generates such a startling response that this physiological hyperarousal, they just can't get back to sleep. And that's why they remain intensely sleep deprived. And also PTSD is associated with other psychiatric comorbidities, such as anxiety and depression. And all those intensely impact on well-being, not just during the day, but at night time. For those who suffer from PTSD, anxiety and depression, there's no doubt there's help out there. And the first port of call would be your own doctor, and let them know what exactly the story is. And he or she would refer you to a clinical psychologist or a psychotherapist to really try and help you cope and be mindful of those traumatic events so it doesn't cause that hyperarousal state and all those behavioural aspects of PTSD. Many unfortunately do end up on a lot of medications such as anti-anxiety medications, psychotropic medications at night time in order to try and minimise that insomnia and also the nightmares. But these medications are never quite perfect and there's side effects, and many patients even put on weight and develop sleep apnea. Some drugs to help sleep, such as melatonin or benzodiazepines like diazepam and temazepam, they just never quite help that primary problem of the hyperarousal generated by the PTSD. However, there's growing interest in the role of CBD or cannabidiol oil, and then also THC, Tetrahydrocannabinol. And these therapies is thought to be helpful in reducing that intense hyperarousal state and also help with the nightmares. And CBD oil and THC, I'm hoping, will be one of the mainstays of treatment for insomnia. And I've had enormous success in patients with PTSD and insomnia and anxiety on CBD oil and THC. And as more and more research comes out and more clinical drug trial results are available, we'll realise that there's hope at last for those with PTSD and insomnia. So I do feel the future is bright. And if you're one of those who are suffering from PTSD, go and seek help, because there is help out there. Don't suffer in silence. Don't recall all the bad traumatic events. Please get help. I will see you next time.